Hi, I'm Dr. Charles Denham. I'm chairman of TMIT Global and the co-founder of the MedTech Bystander Rescue Care Program. This webinar is part of our Survive and Thrive series, and it's entitled Creating Your Family Safety Plan. We have 22 experts who are going to speak today, and we really hope you enjoy it. Many thanks for your attention. Welcome to our 147th webinar over almost 11 years. We're so grateful to have you join us for Creating Your Family Safety Plan. It's part of our coronavirus care community of practice. I'm Dr. Charles Denham. I'll be your coordinator today, and I'm just so grateful to have such a terrific group of speakers. So I'll move quickly through our introductory elements so that we can get right to the meat of the issue. But I need to remind you, and I'm on slide 3 for those of you that have the slides, to make sure to turn your WebEx volume to the max, your computer volume to the max, and your external speaker volume to the max. If you have difficulties, go to the participants window and click on the request phone icon, and Kyle Kemp, our chief of staff, will give you a toll dial-in number. We've been doing this for, as I say, almost 11 years, 147 months in a row, and we've been so grateful to have the voice of the patient and voice of the family to start our webinars and to close our webinars. And I'm really grateful to have Jennifer Dingman, who is a national patient safety leader. She's a winner of the Pete Conrad Global Patient Safety Award. She's been a co-author with us in national patient safety medical journals, peer-reviewed journals, and in national guidelines, and she is a tireless champion for patient safety and family safety. And we meet every other Saturday with a group for over 10 years to focus on patient safety issues. And she was one of the team members that's had an impact of tens of thousands of lives and tens of billions of dollars of savings over the last 10 years. So we're so grateful to have Jennifer start us off. Jennifer, would you start us?
Thank you for your kind introduction, Dr. Denham. It's been my honor and pleasure to work with you, and hope to work with you in the future as well. These webinars are so important for patients and families, as well as providers, clinicians, and frontline workers. Today, I'm very excited about today's program. We're going to learn more. I'm very thankful that you're all here listening and watching our webinar. I urge you to please share the recording and share future links to future webinars with your family, friends, and colleagues. When this is, hopefully when this pandemic is all over and done with, we will all have learned so much. Thank you so much, Dr. Denham, and your team for bringing this to us and helping to keep us safe. I'll turn it back over to you, and we'll have a wonderful program today. Again, thank you all for being here.
Great, Jenny, and we'll have you react at the end, as you usually do. Just briefly about the MedTech Global program. It's part of TMIT Global. I started about 35 years ago. Our purpose statement is that we will measure our success by how we protect and enrich the lives of families, patients, and caregivers. Our mission is to accelerate performance solutions that save lives, save money, and create value in the community. And we try to live the values of I-CARE, I-C-A-R-E, integrity, compassion, accountability, reliability, and entrepreneurship. That's our compass heading. I won't read the slide, but it's on slide 7 are our disclosure statements, and no product, service, or technology will be discussed. These are entirely free, and they are paid for by personal philanthropy, family philanthropy. On slide 8, just to give you a background, we have a network, a collaborative network of 3,100 hospitals and 3,000 communities, and over the last 35 years have grown to have 500 subject matter experts that are doctors, nurses, nurse preventionists, pharmacists, professional administrators, aerospace engineers, and a whole host of experts, as well as frontline experts and people like Jenny Dingman. On slide 10, I just want to draw your attention to the fact that there are 16 industry sectors, essential critical infrastructure workers. You as an audience, this whole program started for us when this coronavirus crisis hit. No one was training the families nor the workers in the majority of these infrastructure industries. There's 16 there. Healthcare is just one of them, but emergency services, information technology, transportation. And then recently, the administration has announced, Homeland Security has announced that teachers are now also part of the essential critical infrastructure, which kind of changes the whole dynamic of making sure how to keep them safe at work. And so an article in August, which we have up on slide 11, kind of tells a little bit of that story. What happened was when this crisis hit, we recruited some of our best and top experts who you see from a number of top medical centers and all ages, including people from lower school, middle school, upper school, colleges, Stanford, Harvard, UCI, UCSF, a number that are represented. And we put together a team of now over 60 leaders, which are on slides 12 and 13, in addition to speakers and those that we interviewed in teams that were part of 2 Discovery Channel movies that we produced, one called Chasing Zero, Winning the War on Healthcare Harm, the other Surfing the Healthcare Tsunami, and you'll see a number of the names and pictures there, Sully Sullenberger, Dennis Quaid, a number of the original astronauts, Professor Christensen, who is my partner at Harvard, who just passed away, Jim Collins, who is the leader of a business leader and best-selling author. We use the model of a community of practice, and I'm going to keep this brief, but over the years, we've put together a number of communities that all teach, all learn together. We convene, connect, celebrate, create, and try to change the world. And you're now part of that by attending this webinar. They're totally free. And this coronavirus care community of practice is focused on families. And what we found out was families of doctors, nurses, EMS leaders, law enforcement leaders, like the 2 great ones we have on today, their families want to be trained, and we found out that the public wants to be trained with the same level of detail. So this is more than Reader's Digest level content. We're giving you the real medical research and evidence-based best practices, and it'll be more technical for those of you that are in the general public than you would typically see, but this appears to be what our audience wants. On slide 16, if you go to our website, this program and a number of programs we've created on masks, on social distancing, on a step-by-step approach building these plans that we're going to talk about today can all be found at medtechglobal.org/coronavirus response. And so you can pull that right off of the page. Okay, so now let's talk about what we're going to do today. This is the first of a 2-part, probably a 2-part program of creating your family safety plan, because this is such an important issue. We couldn't cover it all in just 90 minutes, but we'll introduce this to you. The ideas are, well, what are the science behind the risk to your family? How can we improve readiness? That's readiness if someone gets sick or has in contact with the virus. How do we respond when they do? How do we rescue them if they get very serious symptoms? Then how do we safely recover? How can our family recover? And how do we help other families recover after an event, especially if someone gets severely ill? And then resilience is something that our law enforcement leaders today probably will address. This is what we call, when we work on active shooter events and anti-terrorism, of hardening the target, making your family a harder target for the virus. And then finally, we've got a great panel of college students and 20-somethings and 30-somethings to help us really understand how they might help take the lead. So today we've got 22 speakers. It's in 90 minutes. I know that's a lot in that period of time. You'll each speak briefly, but you'll be able to watch this program and additional content on the website, which will be produced next week and be able to be streaming. And so just to give you some of the building blocks of what we will cover today is that I'm just going to recap our last 2 webinars. I highly recommend that you go back and watch them. The first of the last 2 were Coming Home Safely. It's part of our Survive and Thrive series, and we addressed a deep dive on how to come home and not give the virus to your family members, and then how to prepare to go back to work or school or to where you pray or where you are at Boy Scouts or whatever your activities are, and make sure that you're maintaining the best practices to keep your family safe. Then our second then our last webinar was keeping our kids safe. We took a deep dive on a step-by-step approach to address what we're doing in our families. The reason I mention this is that these are building blocks that will be in the creating a plan. So when we address coming home safely, and I'm on slide 21, we talked about the hot zone where we can be exposed, the warm zone where we disinfect or we're in our car, and the safe zone, which is hopefully where we do not have the virus. Unfortunately, if someone gets sick, or and they have to be isolated or in quarantine, you may have to have an island of risk right in the center of your safe zone at the home, and we'll be addressing this in detail. I won't read these slides because they're in the prior webinars, but for those that haven't watched them, go back and look at them. We address the best practices in the hot zone of the social distance and ventilation and putting on PPE, etc. We address the warm zone, which is where we disinfect, and we really highly recommend that everyone have a disinfection area when you're coming home and when you're leaving, and especially you're going to have a disinfection area if someone is in your home. Then now more and more people are either quarantined or isolated, and we need to kind of think that through. And the safe zone is, how do we maintain the safest area for our kids, safest area for those at high risk with underlying conditions? But we're having an exploding number of younger people that have no underlying conditions, and they're getting sick. So the numbers are changing. That's why they call it a novel virus. In our last webinar, we addressed the issue of creating a plan, and this was keeping our kids safe. And what we basically do, and this is what Chief Adcox, who's one of my just wonderful partners, one of the best men I've ever met, is one of our speakers today. We work together in the science of threat safety science. When we look at the math of threats, threats are mathematical likelihood to cause harm. Vulnerability means what are your weaknesses that can be exploited by those threats, and unless you know your vulnerability, you don't know your risk. And the risk is, what is the mathematical probability of harm? And the real takeaway here, and I'm a systems engineer as well as a doctor, and I'm not going to get into a bunch of jargon, but the bottom line is we need to reduce our vulnerability to any threat. And when we do that, we reduce our risk. So last webinar, we went through a 4-step process. First is identify each family member's threat profile. What are the threat profiles of those that you live with? And we're going to talk to our college students today about the fact that they've got to have 2 plans. They have to have a plan where they're at school with their roommates or their housemates, and then there's the plan home, and then there's the transition from school back home. And a lot of them are contemplating, do I go home for Thanksgiving or Christmas? Step 2 is to identify and follow the local coronavirus threats. Here I'm going to show Orange County, where I live in California, how our numbers have changed. You can't put a plan together and execute a plan unless you really know what the background infection rate in your community is. If you don't know what it is, you really can't adjust your plan properly. A number of us are pilots on this webinar, and I've worked very closely with Sully Sullenberger and others that are jet pilots. I'm a private jet pilot. When we put together a flight plan, we always look at the weather, we always look at the risk profile and the mission or the flight we're going to take, and that adjusts our flight plan. We have to do the same thing here. Step 3 is to develop that family safety plan, which we'll address today. And then there's after you plan the flight, then it's sticking to the plan, which we'll cover in our second part next month. And so step 1 is identify the threat profile. Again, I'm not going to read the slides. Go back to our last webinar. We take a deep dive at how you would go step by step to evaluate your family's risk. And we know from pregnant moms to those that are over 65, we know there's age-related underlying conditions. Obesity is an underlying condition. There are a number that put our family members at greatest risk. Our plan needs to be mapped against that risk. If we've got 5 kids that are under the age 10, we've got a totally different plan than if we have 3 seniors that are over 65 and 1 young person. So you need to put together a good idea of what the vulnerabilities are. And then you need to look at the outside threats. Those are your inside threats. What is the infection rate in your community? And by those 2, you can then identify, well, what are the steps that I'm going to take? And again, I won't read step 2 to you. Now, on slide number 32, last month here in Orange County, our testing positivity percent was at 5%, and we were at a higher tier here in California of risk. and over a 7-day average and a 7-day lag, they calculated how many people are getting infected per 100,000 people. Well, now, today, as of this morning, and I created this slide this morning for you, you can see that our 7-day average has dropped to 3.6, and our positivity percent is 3.1. However, we had a bit of a bump in our infection rate, and we have to wait a certain period of time for that rate to come down. What does that mean to your plan? You need to watch this, because if you see peaking numbers, which we see, let's say, in New York City, and we discussed this with one of our college students yesterday, when we see that going up, we know that there's that we have to behave in a different way. So you want to reduce your vulnerability. So watch our last webinar to go through this step-by-step approach at talking about vulnerabilities. And you can see I'm racing through the slides because these are the slides from last month that I would hope that you would go back and take a look at. Now, today, we're talking about the family health safety plans: readiness, response, rescue, recovery, and resilience. Readiness is preparing with a regular review of what's going on, the latest science, what is the community saying, and being ready in case somebody gets infected, somebody gets sick, or somebody gets exposed. Response means, okay, now somebody's either infected, sick, or exposed. What are we going to do? And your plan is tied to the risk profile of the people. If you're college students that are super healthy with no underlying conditions, it might be a different plan than having 3 65-year-olds in your home and a 99-year-old like my mom who's 99. Rescue is understanding what to do if somebody gets sick. You've got to have a plan. It's very stressful. If somebody starts to get sick, you need to know what to look for, and then you need to know how to go to the emergency department. And remember, you're going to be in the parking lot. So you better send your family member with their medical records if you have them, their medications in a bag, and have a charged phone to talk to the doctors, because the emergency experience is totally different than it's ever been. Recovery is really important. How are we going to recover safely and get back to normal? So, Mr. David Bashk is just one of my favorite people on the planet. He's my partner in teaching kids the area of MedTech and what we're doing. And he's just taken a break from school, so I will go through and then re-review at the end some of the things I'll cover right now. But you need to customize your family checklist to the real-life scenarios that can happen to you. This grid is an eye chart, but we'll go through it today briefly. We'll go through it in more detail as we get in our next webinar. But you need to look at the family scenarios of when you're not exposed and you have no test, a negative test, you're probably very susceptible, you don't have any antibodies. What about when you're exposed to an infected person but you haven't had a test yourself? What if you've been infected and you're asymptomatic, but you've never had symptoms? What if you're infected and pre-symptomatic before symptoms? And you can see each of these categories. These are the scenarios you need to be prepared for. And the worst is at the bottom on the right. What if someone's infected, they're in ICU, they're on life support? What do you need to know about what to do with your family and be prepared? So what we'll do next month is go in a deep dive on every one of these scenarios so that you can build a plan that will work. But we really need to understand the principles of the plan first. I just highlighted exposure to the infected person and no test. What do? Now we're opening the valve up on activities. We're going to see this. What about infected and asymptomatic? And so you can see we've organized the activities and what you need to know for each of the 5 R's for readiness, response, rescue, recovery, resilience. Again, I'm just giving you the highlights and an overview. We'll take a deeper dive. So it's really a great pleasure for me to introduce our first responder and educator panel. We have a pediatrician, a practicing pediatrician in the community who's going to cover one of the acute things that can happen to your kids. That's Dr. Barto-Owens. Paul Bhatia is an EMT. He's here at UCI. He's a terrific educator with us, teaches MedTech. He got COVID. He's going to tell you how important the plan is. Matt Horace is the Chief Security Officer for the Mayo Clinic, where I had my faculty position. I was a professor of health systems engineering, and where I did subspecialty work in intraoperative surgical radiation. We have Dr. Casey Clements, who's the head of emergency medicine at the Mayo Clinic in Rochester, and he's also the head of staff safety for the entire Mayo Clinic. David Bashk, who's an award-winning teacher and partner here in Orange County, who's going to help you understand how the chief family officers really need to focus on building these these checklists. Heather Foster is a nurse preventionist and an award winner as well, had won the Pete Conrad Award for Patient Safety. And Chief Bill Adcox, is the Chief of Police for the University of Texas at Texas Medical Center, and he's the Chief Security Officer at MD Anderson, and a wonderful colleague and a real pioneer in threat safety science. That brings me to Dr. Greg Botz. Dr. Greg Botz is a close partner of mine and Chief Adcox. He is a professor of acute care and anesthesiology at the University of Texas MD Anderson. He's also the Chief Medical Security Officer for MD Anderson with Chief Adcox, and he's an adjunct professor at Stanford, where he'll get on a flight and fly out here to California on a monthly basis to teach residents how to save lives and ride the helicopter and a life flight. So he is, as Chief Adcox is, one of my heroes. So Dr. Botz is in the ICU today, and I'll ask Kyle Kemp to play the videotape or the audio tape of Dr. Botz. Dr. Botz, thank you so much for taking time to go through the critical importance of the family safety plan. Let's start with readiness.
Sure, it's great to be with you again today. In preparation for a family plan, readiness is an important state. And readiness really is knowing whether your family is ready to follow the plan. And so that takes things like a group reinforcement of the elements of your family plan and deliberate practice to make sure that you're actually able to accomplish things. I think one of the biggest mistakes that people have is they believe they can follow a plan, but they haven't practiced yet. And so they don't know if there are any gaps in their ability, and their plan may fall apart.
Great. And we talk about response. So responding if someone is infected and sick, or notified that they might have been exposed to someone who's infected, and we have to address quarantine versus isolation and being able to respond if someone's sick.
Well, that's right. Really, response is having your plan in place so that if the need arises, you can activate it and use it effectively, and knowing how to go from, let's say, normal operations to implementing your plan is an important step, recognizing and detecting the need to activate your plan.
You know, we are so proud to work with you, and you're one of our heroes as a critical care doctor, probably taking care of some of the sickest patients in the country. Rescue is absolutely critical, and knowing when we might need to take a loved one or a roommate into the emergency department and being prepared for the whole process is critical. What message do you have there?
Well, I think it's really important to know when your initial family plan is not working. If someone is showing signs and symptoms of worsening breathing or fever or other symptoms that would indicate that they're becoming more sick, it's important to activate perhaps the next stage of your plan, which is seeking additional help, whether that's in contacting your physician's office or going to an emergency room to be seen.
And so critical to have medical records and medications, and being able to provide a history is vital, isn't it?
Well, absolutely. I think that's a key element of the plan, is having readiness to move on to the next step when your sort of shelter-at-home plan is no longer effective.
And now when we talk about recovery, when we're either through quarantine or through isolation or recovering from COVID-19, one of the critical issues is to be able to safely return to some more new normal, isn't it?
Well, that's absolutely right. In working in emergency management situations in many organizations, I have recognized that one of the challenges is going from emergency operations back to normal operations. Many organizations struggle with that, and they remain stuck in this cycle of maintaining an emergency stance. And so recovery is a key element of returning to your normal operations.
And recognizing that we might get reinfected or we could be re-exposed. So finally, resilience, and we talk about target hardening. Can you explain that to us in the context of a family and having resilience and hardening our target to threats?
Well, sure. I think that one of the goals in having a family plan for no matter what the issue is using deliberate practice to not only practice those steps that are important in our family plan, but recognizing that there may be situations that challenge our plan in different ways, and recognizing that we have to roll with the punches, if you will, and have a backup plan or a stance where the family can react to any changes effectively without falling apart. In my circumstance, no matter what the challenge, whether it's infectious disease like COVID-19 or natural disasters like hurricanes, we're in hurricane season currently in Texas, or even things like loss of power or resources in the home. We have to have a plan for going on to emergency status, returning to normal status, but also recognizing that we have to be flexible enough to respond to whatever the wave that may hit us next might do to our plan. And that resilience is a key function or a key feature in highly reliable teams and organizations, and more so in highly reliable families.
Great. Well, thank you so much. We sure appreciate all you've contributed to developing MedTech and accommodating this new challenge and making that part of the program. Thank you. We're so grateful for your input.
Thank you very much. It's been a pleasure to be a participant and a contributor to this effort.
Our next speaker is Dr. Brittany Barto-Owens. She's a community pediatrician, and it's embarrassing to say that I've known her since she was a little girl. She's now a practicing pediatrician, and I've asked her to address the issue of one of the most severe things that your children can experience in terms of the COVID-19 infections. Kyle, would you please play her tape? Brittany, thank you so much for sharing a little bit of time with us today regarding kids. Can you tell us about this more serious and severe condition that can happen to children, MIS-C?
Sure. So MIS-C is a multi-system inflammatory syndrome in children, and it presents differently than COVID. So the primary COVID infection you really think of as your flu-like symptom, cough, congestion, sometimes vomiting, diarrhea. Multi-system inflammatory syndrome in children occurs about 2 to 4 weeks after the initial infection, and it's an inflammatory reaction, we think, to the actual infection. So if you're thinking of inflammation, the way that it presents is related to that. So you always have a fever 100% of the time. You, about half the time, have a rash. You think inflammation of the skin. Then you have inflammation of the eyes. You'll get red eyes, inflammation of the GI tract, belly pain, vomiting, diarrhea. Those are your primary symptoms with the multi-system inflammatory syndrome. So if you're concerned at all that your child is having these symptoms 2 to 4 weeks after their primary infection, I would go to your doctor right away. The reason that this is so important is because it is a very severe disease. The children all have to be hospitalized, and about 2/3 of them are actually in the ICU requiring more intensive care. And something else to think about is the cardiac impact of it. They're finding that the echoes in the hospital, about 50% of them are abnormal. And even following these kids over time, they're still continuing to find some abnormalities. So it's something that needs urgent evaluation if you're at all concerned that your child has this.
And this is such a new disease that we really don't know the long-term ramifications. So it's probably pretty important to keep your kids as safe as possible from being infected, even though out in the media they may talk about it not being very common. If they do get it, it's pretty serious.
Yes, and the only way to prevent is to prevent the initial COVID infection. Once you have this inflammatory process, all you can do is supportive care. Another thing to note is that these kids are generally well children. They don't have chronic illnesses. They're not sick kids to start with. About 2/3 of the kids hospitalized for this syndrome had no complications at all, had no prior medical conditions. And the biggest one that they did find was actually being overweight, which is something that a lot of children have at baseline.
Right. So, Brittany, as we talk about putting together a family safety plan and we think of our kids and especially the little ones, you just want to review for us what we need to keep in mind regarding quarantine and isolation and how long to plan to be caring for a child?
Right. So I think now that we're having our kids back in daycares, back in schools, back in social gatherings where they're getting exposed, it's good to come up with a plan knowing what the actual rules are. So if your child has a positive COVID test, they need to stay in the house for 10 days, and you, the parent who is exposed to the positive, is a 14-day quarantine. Now, this is only true in some cases. So if a teenager is able to quarantine themselves with their positive, the parent is quarantined for 14 days and the patient is quarantined for 10 days alone in their room. If you have a little kid, like a 2-year-old who ends up having a positive test, they're quarantined for 10 days, but since obviously there's no separation between the parent and the child, the parent's quarantine actually starts on day 10 of the child's illness, so it's 14 days in addition, a full 24 days. So I think when we're thinking about family plans, it's really important to recognize how long you would really be out if your child ends up getting COVID.
Wow, that is so important for planning, especially and these are kids that are under 24 months?
I mean, any child that's not able to take care of themselves.
Okay.
The parent isn't able to isolate themselves from their child.
So a full 24 days. Wow.
That's what they're doing.
So do you think it's important that families with children put together one of these safety plans?
Yeah, I mean, it's very likely that at some point during this pandemic, they will have an exposure, so it's good to be prepared.
Fantastic. Brittany, thank you so much for sharing your time and your expertise with us.
You're welcome.
Great. So it's my great pleasure now to have Mr. David Bash speak. He's an award-winning educator, he's a developer of many powerful and impactful programs in STEM. And he is a science teacher here in Southern California, an award-winning teacher who's also been from the very beginning, a teacher of our MedTech program for bystander care, which has expanded into the COVID space for the 8 leading causes of preventable death for emergencies, what to do in the first 10 minutes, and we've been teaching kids from 3rd grade on up. It's been a joy to work with him, and of note is the fact that he saved the first life with MedTech. We hadn't even graduated our first class. He learned a technique on a Thursday and saved a life on a Saturday. So I'm asking Mr. Bash to help recap for us the concept of the Chief Family Officer, what we call the CFO, and then talk about what we can do with our kids to put together our family safety plans. David?
Excellent. Good morning, Chuck. Thank you for the opportunity. It's a pleasure to be here with everyone. So as Chief Family Officers, as CFOs, as we all know, we wear many different hats. And one of the many hats that you're going to have to put on and wear with fidelity is being the chief educator in the family. And we all know that with the ever-changing world out there, the information that seems to be changing on a day-to-day basis, young children, reacclimating back to school, and what are the processes with that, and how much should we be kind of letting other friends come to the house, and what do play dates look like? There are a lot of questions. And with a lot of questions come a lot of emotions. And as an educator, that's the number one thing that I need to keep in mind when I'm educating children and other people is managing emotions, because emotions can get in the way of learning. Emotions can get in the way of teaching. And so the number one thing is the chief family officer and, i.e. the chief educating officer, is to make sure that we're keeping everybody's emotions under control. And that for me, the most effective way that you can do that is with honesty and with clear, direct communication. So as a chief family officer, when you're putting together your family plan, number one is you need to make sure you're doing your homework. You need to make sure you're reading. You need to make sure that you're taking notes. You need to make sure that you are digesting the information so it works for you, so that you're able to effectively, calmly, and clearly and honestly disseminate that information to the rest of your family. As what you can see in this picture here, I love this picture because it really does show how involved everyone in the family really is. You've got the young child there coloring in her coloring book. You've got the dad taking notes. You can see everybody's engaged. This is what the plan and this is what the sharing of the plan should look like. MedTech, we have the all teach, all learn model, and I think it's really important that everybody understands their role in the plan. And I don't think that we need to run from facts that may seem scary to even the youngest children. Children, I think one of the things that has come out the most in this whole process of COVID is just how truly resilient children are. And I think if we give them the information honestly at their level, that they can digest it, and then we're going to see emotions start to go down, and everyone's going to have a better idea as to what they're doing. So sharing information as the chief educating officer of your family is critically important. Make sure everybody understands why you have a plan. Make sure everybody understands all of the points of the plan, and let them understand the severity of the plan, like how this plan can really truly be important and such an impactful portion of our life if somebody in our family does need treatment. Like Dr. Boat said, I think it's an incredibly important point is the deliberate practice. You cannot just put out the plan, have a family meeting around the kitchen table, talk about what's going on, and then put this on a shelf. This is something that needs to be revisited. This is something that everybody needs to make sure that they understand what everybody else's roles are in the plan, not just their own. And you need to practice it deliberately. Make it a bi-monthly thing. Make it a weekly thing. If information changes that you feel is important for everyone to know, convene a quick family meeting. Hey guys, we need to make an edit to our family plan regarding, coronavirus. Here's what's going on. Here's what we're being told. Here's how this impacts us. Excellent. And let's practice it. Make sure everybody can tell you what their role is. Everybody can show you where certain things around the house are. And as a chief educator, one of the biggest things that we can do is we can put together these plans. We can share it. We can feel really good. The kids look like they're getting it. You feel good. You kind of feel like, you've done your role really well. But one of the best things you need to do is you need to be listening. And if you're giving your family an opportunity to share their roles, you oftentimes will hear information. Your kids will teach you way more than you've ever taught them. I can tell you that on a daily basis. Listen to what the feedback they're giving you. They'll sometimes come up with these wonderful statements, phraseologies that work for your family. Adopt it. They'll tell you, hey, Daddy, hey, Mommy, this seems kind of weird. I don't quite understand this. Why are we doing things this way? That's a cue to you that you need to probably adjust something. You need to either adjust what you're telling them, the information, or you need to adjust the actual processes. So as a chief family educator, number one thing you need to do is do your homework, understand what you need to do, make sure everyone is involved, give everybody a role, give everybody a say, have deliberate practice, and be a good listener. Being a good listener to everyone in the family is a great way to modify plans that best fit you and your family, because there is no one plan that fits all for everybody. We all know that every family is different. Every family has nuanced changes that they need to be accountable for, and that's the thing that you need to manage the most. Thank you very much.
Thank you, David, and really appreciate your help. It's shocking. I think it's been shocking to you and I how much our third graders and fourth graders actually learn and how much they can put to work and how comfortable they are and that they're not scared when we talk about saving lives. I think you and I have been really shocked when we teach CPR, automatic defibrillators, how to use tourniquets, and not only are you a gifted teacher, but a gifted demonstrator. And I think just making games out of things, which we see on the slide,
yes,
and a couple of your other ideas of using icons to make things more friendly, kind of have been really great. The other thing is role playing. I think, do you want to just have just quick couple of seconds just on when we have a graduation from MedTech, how we demonstrate and have them play out a scenario in front of their parents? You want to just recap that?
Oh, yes, please. Thank you for bringing up those other points about gamifying and icons and things. That's important points as well. So the role-playing part, I think, is part of the all teach, all learn model. So at the end of every MedTech session, we have students present and teach and show the parents what they've learned. We'll have one or two students demonstrating CPR, one or two students demonstrating bleeding control. And this goes all the way down to incoming third grade students. These are young children that are hosting these wonderful little live sessions for their parents, teaching them how to do these somewhat complicated actions. And Dr. Denham, the only way that we're able to do this is that if everybody is teaching and everyone is learning. It goes back to that everyone has a role in this. And don't pigeonhole people. Take people out of their comfort zones. If some, like you see in this family here, have the boy in the dark shirt take over the role of the boy in the pattern shirt, and have the little girl try to tell daddy what mommy's job is. Give everybody ownership and role playing. It's a great way to solidify. It's a great way to identify gaps in understanding where you can really teach into gaps that you'll be noticing from people, and it just creates a bond and a sense of unity, and it makes the whole thing kind of fun. And it's a part of being deliberate, and it's a part of really having that practice. And I think it's a critical aspect to do.
Thank you, David. And one part I left out so that I could add that at the end is that you're one of our role model Eagle Scouts, and we have a Scout and faith-based group at the end of the webinar. I know you're heading back to teach at school, and we're so grateful, but thank you for also the leadership there. We really think that there's an enormous role that Boy Scouts and Girl Scouts and membership faith-based organizations can play in stimulating and broadening and making people aware of what they need to do, because our public health education has really failed in the United States. It's something our communities need to do. So, David, thank you so much for your time. We'll let you get back to teaching science and wear your mask.
Thank you.
Take care. So.
Stay well.
Kyle Kemp, would you please, we're going to now hear from Paul Bhatia. Paul is a very gifted pre-med student. We've been working with him over the last couple of years here at UCI, University of California, Irvine, along with Randy Steiner, and who you'll hear from shortly, as well as the emergency medicine department here in California. And Paul is a very gifted instructor. He's an EMT, and he'll share his story. He actually did get COVID, and he'll tell you how that might impact or might have impacted his approach at a family plan. Kyle? So, Paul, as an EMT, how are you putting together your living plan or your family plan?
So it starts off with getting to the drawing board, right? You have to identify that chief family officer, that CFO in your household. For my household, that's me because I'm the most medically oriented individual. My mom works in mortgage. My brother is 12 years old, and I have a dog. Once you kind of identify that individual, you have to have a plan and put it in writing. So I went ahead and drafted everything from identifying the threat profile of each member of my family. And seeing how we can kind of structure our apartment household as needed, depending on, let's say, I come home and I'm starting to become symptomatic, or somebody else like my brother or my mother comes home and they're symptomatic. And essentially take that, put it in writing, and we have it placed on our fridge. We have it placed kind of everywhere around the household, and really kind of drill that through each family member, my mom, my brother, and I, just over and over again repeatedly. And essentially the idea is, let's say me, I might be considered the most high risk out of my entire family, right? Because of the exposures that EMS faces. And as in previous webinars that we've had here, you have to again mark out that hot zone, that warm zone, and cold zone. So for us, the warm zone is going to be our patio area outside the front door. And from there, keep track of essentially putting distance between you and those around you in your family.
Fantastic. Now, have you put together a strategy if someone is sick and COVID positive who has to be in isolation?
Yeah, so actually I started having symptoms not too long ago, about a couple of weeks ago. And so it started with couple of interesting symptoms. I got a little bit fatigued. Then I got an actual fever around a 101, 102. I scheduled myself for a COVID test. It ended up coming up positive, but what we did as soon as I figured out that I actually had symptoms was we put the plan in motion, right? So our plan was my room would essentially be my kind of isolation room, and I would really only come out for things like food when no one else is in that same shared area, and we would have a pretty strict cleaning and sanitizing regimen, and that's pretty much it for the most part.
How about masks?
Oh, absolutely. Yeah, masks were number one the entire time. I forgot to mention that. Yeah, I have like 50 to 100 masks just in my room, and we have some scattered around the house in our vehicles.
Fantastic. So you really put the plan to work, and then you had to you planned the flight and flew the plan.
We planned the flight and flew the plan. Yeah.
Fantastic. Thank you, Paul, so much, and thanks for all you do in our MedTech program to help instruct and to help those students at UCI. You're a terrific guy.
Yeah, I'm glad to be here. Thank you.
So our next speaker is a very, very gifted and well-educated and probably one of the best educated people that we could ever have speak to us because he's an emergency medicine doctor. He is the head of staff safety as well as the director of emergency medicine at the Mayo Clinic. The largest Mayo Clinic is in Rochester, Minnesota, where he lives. And he also has a PhD in microbiology and immunology, which is right in the sweet spot of where this virus is targeting us. So he's somebody who takes care of COVID-19 patients. He's someone who is responsible for the safety of the caregivers, and he's someone who is one of our top researchers and top leaders in infection. And we frequently have had him before the COVID crisis speak to us about sepsis, which is the overwhelming serious infections that we can get when we're very sick in the hospital. So we'll hear from him. He's in the emergency department now, so we recorded him last night. Thank you so much, Dr. Clements, for sharing your time with us today. What's your message for our audience?
Thanks for having me, Chuck. I really want to chime in and help stress the importance of making a plan for what-if scenarios. Your family is one of, if not the greatest concern that I hear from critical essential workers. They say things like, I don't want to bring this home to my family. In fact, I've had 5 calls this week from friends across the country who've had either exposures or actual infections asking me, well, what do I do now? And a lot of the stress of those situations can be offloaded if we make a plan up front. I think it's important to realize that the majority of household contacts don't actually get infected if precautions are taken, even if one of your family members gets infected. And this is important in understanding the differences and needs of isolation and quarantine. You know, we're used to talking about quarantine where you sort of stay away from public places and hold up in your house. Isolation is even a step further than that, where someone who's infected or has a high-risk exposure may sort of sequester themselves away. Oftentimes this can be in something like a bedroom with an adjoining bathroom, and really they may not leave that area for several days. It's important to do some of these things to protect other people in the household, and particularly the elderly and medically frail. In last month's webinar, they talked about family unit threat profiles to help identify those people, and you may want to go back and watch that or check it out in order to help identify who that may be within your family. You have to understand how long a quarantine may be in a given situation, and that could vary. And you have to think about where will an exposed family member isolate themselves. And there's some big details to think about in making these plans. When should you seek help in an emergency department or even need to be hospitalized? In my specialty, emergency medicine, we deal with this all the time. And some of the danger signs can be severe shortness of breath, confusion, or even lightheadedness to the point that you feel like you might pass out. You know, what could happen when you go to an emergency department or hospital should also be, you should be aware of and to have in that plan. You may not be able to visit your family members, but it's important to stay in contact with their care team. A lot that's in these plans are actually mundane details. How are you going to get groceries to the home? How are you going to retrieve and clean dishes and laundry from someone who's in isolation? The CDC has some guidance on that, and that can be discussed as a part of your family plan. And just in summation, I want to thank you, Chuck, and the rest of your team for really shining a light on this. This is a very practical topic that needs to be covered for lots of us.
Well, thank you so much. And as a leader of emergency medicine at our top hospital in America, for you to take the time to help us, thank you so much. We're so grateful.
Yep, everybody stay safe.
So I just want to remind those that have not watched to go back and listen to Dr. Christopher Peabody, who's I've actually been we've been working with since for almost a decade. When we were both at Harvard, I was an advanced leadership fellow, and he was and on faculty, and he was a medical student. He's now an associate professor of emergency medicine at UCSF. and we went through the 5 rights of emergency care. Make sure to watch that on our website or in the last webinar, and it'll go through the details of how much different the whole experience of going to the emergency department is. If you haven't been during the coronavirus crisis, you'll be shocked. You will not be able to go in with your loved one. You'll have to remain in the parking lot. It'll be very hard to communicate, and there are some really great tips that you should put into your plan. And so, speaking about Mayo Clinic, Matt Horace is the Chief Security Officer for all of the Mayo Clinic. He's a best-selling author. He has an extensive law enforcement background and history, and also he's had 2 of his 2 children. Both went to West Point, and he'll share a little bit of his story. He also got COVID from a family member. So, Kyle, would you please roll tape?
Really appreciate you taking the time to record this. So, the family safety plan and the first R of readiness. Thoughts?
Well, I think that it's important that we treat this the way it should be treated by making sure that the people who are most important in our lives are safe and healthy and remain safe and healthy. And the way we do that is by being ready for any and everything.
And then response, and in your law enforcement officers, the opportunity for them to understand that they might bring the virus home or someone might bring that virus home to their family, and knowing what to do if somebody gets sick.
Right. Well, there are 2 aspects of that. There's the aspect of recognizing what the threats are. How do you respond to potential exposure? But then what to do if you've identified an exposure on your behalf or someone in your family, how to respond as a family to make sure that the rest of the family doesn't suffer the same consequence.
And if a contact tracer contacts your family or your essential critical worker or teacher or anyone is notified that they've been in contact with someone for longer than 15 minutes within 6 feet, knowing the difference between quarantine, isolation, and the purpose of testing, right?
Right. Well, at that point, the world must stop. You have to pivot and revisit everything that you've done during the last 24 hours, revisit who you've been around, who you've been exposed to, but also then you treat your family in a whole different way as not to place them at risk.
So, Matt, the third R is rescue, and having experienced having the COVID experience yourself, how important is it that the family really understand what to do when severe symptoms develop and the care regarding those to know when to go to the emergency department?
Well, I think it's, out of the 5, it may be the most important, because that is, at that point, it's incumbent upon you. If you identified symptoms, you need to speak to a physician. You need to understand collaboratively what those symptoms mean and what to do next. There's the what next factor. Do you isolate? Do you quarantine? Does someone else in your family have the symptoms? How do you isolate and how do you quarantine in a house? These things aren't easy, but they're definitely possible, and they're essential to make sure that you don't have a mass spread event in your own home.
And the severe symptoms of shortness of breath and the other problems, even though you work at the #1 hospital in America by U.S. News World Report ranking, but for you to know when to go in and not to go in is critical.
Well, that is very true, but you also need to know when you stop the world and make that call and say, I'm having symptoms, take your temperature. If you have a temperature above a certain amount, you got to stop the world. You have a cough, you have dizziness, you have headaches, you can't sleep, you have diarrhea. You got to understand in this pandemic world we live in right now, all of those things matter.
So you're an expert in threat management. Talk about recovery and how, as a family, we can look at the recovery process to get back to normal, which you've been through.
Right. Well, you have to treat this, I think, just like you would any other threat. You have to evaluate the conditions of threat, what caused those conditions, and how to mitigate those threats as you move forward. And the list could be many, but if you ignore it, you don't stand a chance. If you acknowledge it, you treat this threat just as you would any other major threat.
And so important as you gradually get back to work. The final R is resilience, and in the field of anti-terrorism, when dealing with active shooter events and law enforcement, we call it target hardening. What are your thoughts regarding developing resilience for the next wave or surge or epidemic or even storm or a national emergency?
Well, all of these things should go into your family resilience toolbox, if you will. Because once you get through a crisis and once you've mitigated a threat, it should help you prepare for the next round. And I treat it like this. It's not a matter of if, it's a matter of when. And when the unthinkable occurs, your family, just like a business, you need business continuity and resiliency. Your family needs to be resilient and recover from the effects and impacts of a bad event. So you have to treat it like you must survive, you must be resilient, we have to live, and we have to maintain that family structure and get prepared for the next time.
So finally, your message to the general public regarding putting a family plan together.
Put your family first. Work is one thing, family is another thing. Put your family first. Make sure you protect family. It will make you a better, more productive, and more efficient employee.
Thank you, Matt.
Have a great day, Chuck, and thank you for having me.
So we have from the two leading hospitals, number one ranked hospitals in the country, one in cancer, one in general medicine, Mayo Clinic, and in cancer is MD Anderson is Chief Bill Adcox. He is a close partner of Dr. Botz and I in the work on MedTac and the MedTac Bystander Rescue Care Program. His law enforcement officers and security officers are part of our study that we're undertaking, and we're now north of 500 responses, heading to 1,000. We want you to take our survey at the end of this webinar, and we're studying each of these 5 R's. Chief Adcox, thank you so much for being with us today. You're a pioneer of threat safety science. What would you like to add to what Matt had said and what Dr. Botz and the other speakers have said?
Well, good afternoon, everybody, and thank you so much for allowing me to participate. I think Matt and Dr. Botz and everyone has added so much. I just want to make a couple of small points. First off, when we talk about readiness, and going back to our top educator in David Besh, Mr. Besh, he talked about the children and communicating, and I must tell everybody that it's very important that we talk to our children and not at them. And we get into a mode where we get stressed and we just start wanting to pump out information, and sometimes we don't take that time, like David said, to stop and listen. So take your time, be serious, but be calm, and make sure it is a family affair and that it's a two-way communication. The other thing we talk about is being ready, and it's target hardening. And in the community, when we talk about crime prevention, they usually talk about the crime prevention triangle, where you have to have desire, ability, and opportunity. You have to have all 3 of those things present in order for there to be an adverse event of a crime. And so if we can take away the opportunity, meaning if we can harden and prevent the virus from even approaching or getting into our home and to our families, then we're not going to have that problem. And so that's going to be extremely critical. And so I think that's very important. I also will tell you that when we talk about resilience and coming back to it, we have to do best practices, and we talked about, from Dr. Botz, talked about highly reliable families, highly reliable organizations. We have to go back and do an after action, or as in the medical profession they call it postmortems, where you kind of review everything that went right and everything that didn't go right, or maybe some gaps, what we call near misses. That's going to be very critical for us to do that. And we also got to remember that that's got to be part of your planning. So if you fail to plan, you're basically planning to fail. And so planning is going to be very, very critical. The last thing I will say, it's all about stress. And you're, as first responders, as a parent, as a first responder, as a teacher, whatever it might be, there's critical incidents that happen in our lifetime. Most of the average persons in our great country will experience 1.5, maybe 2 critical incidents in a lifetime. Those on the front lines of first responders and so forth, you're going to experience 800 plus, and that's going to be extremely highly stressful, and it takes a lot to get past each and every one of those critical incidents. So think about it, as a first responder, you're going through these things and you're seeing these bad events, and then you're coming home, and again you're not having that opportunity to de-stress. And the way you're going to do that is you got to plan for your family. Take care of your family first. You're not going to be any good to anyone else if you personally are not healthy, and secondly, if your family is not taken care of. And I'd say that about everybody. So if you have a good plan in place, if you pay attention to the 5 R's, readiness, response, rescue, recovery, and resilience. And you really pay attention to this material that's offered here today, and it's on the website. You're going to de-stress a lot in your life, and you're going to be more effective. You're not going to miss things, and you're going to be able to have early intervention and pick up on things. And that's what threat science is all about. It's being able to see these threats early and being able to take care of them before they become a really bad situation. So I want to thank everybody for what they've done today. This is a fabulous program, and I really appreciate the opportunity to participate. Thank you.
And Bill, let us thank you also for your folks that are right on the front line. You're taking care of the sickest patients. You know, as a cancer doctor, I know how sick the patients are and the families that you take care of. And you're really pioneering so many different things, de-escalation and being able to really lead the way in law enforcement at a time when it's pretty tough. And then you've got the added risk of COVID. And thank you for bringing up your law enforcement officers. And we just want to thank the families right now of those that are caregivers and frontline folks, because we know you're at higher risk. And that brings me to a wonderful person, Heather Foster, who's also another national award-winning leader who's a practicing nurse. She's the one that is putting herself and her family on the line every day when she goes in to take care of patients. She's a trained infection preventionist, and Heather has helped us as you get deeper with us in our community of practice, and as we move into part 2 of building your family safety plan, and we get into the real nitty-gritty detail of how to put together an isolation room and how to take care of someone who's really sick in your home if you have to do that, or you have to help another family member, or you're a scout teaching a troop about that and delivering community service. It's Heather and Dr. Botz and other of the scientists that have worked with us that help put that curricular work together. So Heather, thank you very much for that work that they haven't seen yet. But Heather, what would you like to add now as a practicing nurse, your message to other frontline caregivers as well as families? Because you see both sides of it. You're a caregiver of people that are sick in the hospital, and you're also a mom, and you're taking care of a family. You kind of see both sides.
Yes, thank you, Chuck. I think we do. Those of us that are working on the front lines, I hear both sides. I wish we could just all get infected. Let's move on. And then I hear, you know, the stance of, wait, we need to be a little bit more cautious. I think, you know, what I fear is, I think about, we just had a patient this week who had known COVID but was still roaming the community. I think we're still not getting through to everybody, especially those who feel like they're not sick. So we know that there's going to be a majority of carriers that are pretty much our biggest spreaders. We have to really, I think, target that population group, albeit carefully. And with that, Chuck, I think as we embark on the next wave, I think we're starting to see that we really have to, it's going to really test our endurance. And that's where I think the resilience is going to be strengthened. I think we're all tired. I think we're all excited as things were starting to open up, but we're starting to see a little bit of an uptake there, like you said, in New York City. So people are tired, but this is where we're going to have to dig deep in the family setting, in our work area, and it's going to be vitally important that we support one another towards just a common goal, and that is eventually herd immunity. So I hope that helps. I think we're all on the front line. We really are.
Well, thank you, Heather, and hang in there. After we speak with our college and young adult group and our scout and faith-based group, I look forward to your comments, at the end, because we're moving into this new knowledge about spread. So what I'm going to do, thank you, Heather, so much. I'm going to move quickly through a few slides to set up our young adult group, but I want to remind you that the study that we're undertaking now, and we are surveying you at the end of this, and please, if you would, fill in our survey survey when we get to it. We're covering the 5 R's. We're studying how prepared families are, and then what do they need. We have free text entry, and as I say, we have over 500 responses. We're heading to 1,000, and we're so grateful for MD Anderson, Mayo, UCSF, UCI. We also have some federal law enforcement agencies, and we won't use their names just out of proper respect, but we have a number of organizations as well that are sharing that. So when you say, well, Dr. Denham, Chuck, what have you learned from this study and this work since March? And what we've learned is that the family unit is the Achilles heel. This is what is defeating us. It's not actually Heather at work wearing her mask, practicing hand hygiene, being very careful with her patients. It could be the Heathers of the world, our nurses or our law enforcement officers or any of the 17 industry sectors, now teachers, that are coming home and getting it from another family member unsuspectingly, because they feel like they're a little more safe at home, and that's why we have to train the family unit. So what we've learned, our discovery is family unit training works, and that's not only, and a family unit, we're talking about college students, you might have 2 family units. You have your family living unit at college. We'll be hearing from Danny Policicio at NYU at film school there, and with roommates as well as people at UCI as well as other places. And you actually have to have 2 family plans. But what we've learned is that if we focus on the family unit, we can save. We can really have an enormous impact. When we talk about our family unit, we're talking about when you're going home, every one of the people who you live with are moving through the community from school, work, going to visit elderly people at a retirement home. And so what we've learned is we can't just train the essential infrastructure workers alone. It will not work. The family unit is the Achilles heel. That's why we're so grateful we have so many family members of those of you that are part of this, our critical infrastructure that have to go to work no matter what. That's putting food on the table, grocery chains, retail, information technology, transportation. If we save the family unit, we save the worker. If we save the family units across our communities, we can save our nation. This is the heat map from Johns Hopkins that shows our infection rate. Look at Canada, where I lived for some time, and the United States, and 2 different sets of behaviors. And you can see, and although they have 10% of our population, you can see the enormous focus. So we really can save our nation if we focus on the entire family unit and transmission. That's social distancing, and there are new things in that. When you go to our website, you can watch a short video of 13 minutes on the latest on social distancing. We have a 26-minute, 27-minute video on the science behind masks, how to pick them, which ones to use, how they work, how you can make sure to have them become more effective. And we've had leading scientists help with these. Hand washing and why it's so important, and how soap works. And this is something we could teach right down to our kids. Why it's 20 seconds, why soap and water is better than just about anything you can use to clean your hands, and that high contact surfaces. There was some misinformation out on the web that said, oh, you don't have to worry about high contact surfaces. It was misinformation. Actually, you don't have to worry about it as much, but it is a mode of transmission, absolutely positively. So although we don't need to obsess on disinfection, we really need to maintain that. And then many of you are going to end up with family members that are in the ICU on respirators and on something called ECMO, which is the artificial lung. So we have an 8-minute video to kind of walk you through that. We have a series of publications that we'll be putting out. This is the one on the science of masks, and it has the narrative that goes along with the video so that you can kind of follow it. And the key issue on aerosols and droplets. The science every day is growing to show the aerosols, meaning that under a certain size, 5 microns, over 5 microns are droplets. Under 5 microns, when you breathe, all of the fluid is evaporated, and then the virus floats in the air and can float much farther than 6 feet. This is why we don't want to go into poorly ventilated areas. We have to be very, very careful. When we go on a flight from one place to another, we say, well, they've got HEPA filters on the airplane, but they don't in the jetway. They don't in the bathrooms. And so aerosols are the tiny particles that are there. We also address
the choice of masks and why some masks work better than others, and why a good surgical mask that's well fitted can be as good as anything that you can use, because you really need a fit test for the N95 mask. So it's a real pleasure now to listen from our super spreader group, and they acknowledge that they're super spreaders, and they know now, they're starting to realize that they can have a real role in helping us understand what to do and put together the strategies for a safety plan that would be their home safety plan away from home when they're at college. And so Jamie Iristorza is a pre-med student, a terrific young man, an Eagle Scout, and I think has a great grasp. We're putting up for him first. He has a great grasp of where we are in his age group. Kyle, would you roll tape?
So, Jamie, what do you think of the concept of the 5 R's and thinking about your family away from home away from home when you're in college?
Well, I think it's a really excellent plan that people should be aware of, because it's really simple. 5 R's, it's really easy to remember. And developing these plans and these response patterns is really, really critical in finding a way to make a safety plan and make sure that your family is safe during this very tumultuous time.
So what about the first R, readiness, being able to work with roommates and your family at home to be ready to respond if someone does get sick or is exposed to the virus and we need to quarantine or isolate?
So I grew up in the Boy Scouts, and the Boy Scouts always say, be prepared. And I think that's a really phenomenal philosophy for all of life. And especially in this time, to solve a problem, you really have to understand the parameters that surround it. And so readiness and being ready to understand the ways that you need to solve the problem is really, really critical.
So what about response? Do you think the college students and graduate students that you know would know how to respond if somebody was sick with COVID or COVID positive but asymptomatic, or was exposed and a contact tracer contacted them and said, hey, listen, you need to go into quarantine?
To be honest, I don't think so. I think a lot of college students will respond to this as they would respond to any other sickness. Like when I got the flu at college, my roommate would probably respond to me getting COVID in the same way that he responded to me getting the flu. There's a lot of really specific things about mitigating the spread that are specific to this specific disease in place and time that aren't exactly universal as the way young people would deal with sick peers and for other diseases. So I think educating the specific tools that you need to be prepared to deal with COVID patients is really something that everybody should know.
So now let's talk about rescue. Let's presume that you have a roommate or a family member, and I think your age group, the super spreaders 18 to 25, need to not only know what to do at college or when they're in a living unit, but also what they need to do when they're at home. What about rescue? How prepared do you think the college students are regarding being prepared to rescue somebody if a family member gets severe symptoms?
I think that's pretty minimal, and I think that kind of stems from the fact that most college students, I think, have the mindset that if they get the disease, it's not going to be serious. And so the potential that you might have to deal with someone going to the hospital and you might have to deal with someone getting severely sick, it's not really on the forefront of a lot of the young people's minds, and so that's also very important to be aware of.
Now, how about the fourth R, recovery? Getting back to normal after quarantine, isolation, hospitalization, or a family member gets sick?
Again, I think, to all of us, the end of this thing seems so far away. So recovering and going back to normal is also something that we really need to keep in mind if we're going to have a healthy outlook on this disease, because there will be an end, and we need to be able to understand that, your life cannot go down the dumps. There needs to be a way to return back to normalcy no matter what happens.
Now, the final R is resilience, and in anti-terrorism and the work we do in active shooter events and that kind of thing, we call this target hardening. Do you think that there's value and think that college students will relate to the idea of then being hardening the target and making us more resilient to the next wave, this epidemic, pandemic, or the next national disaster that might even be a hurricane?
Of course, I think that's one of the most important things that we need to keep in mind, because when you deal with crises like this, you either prevent it altogether, but because we can't prevent COVID and it's already here, the best we can do is to reduce the impact that it's already had. So to be more resilient and to target harden, as you said, is really something that is going to, A, shorten the wave, but also make the rest of the pandemic more bearable for all of us.
Jamie, many thanks. We wish you luck in medical school.
Thank you very much.
So Jacqueline Botz is a student at Chapman University. She's an opera singer, very accomplished, and we've asked her perspective out here in California. So Jacqueline, you're a voice performance student at Chapman University and perhaps have some unique needs, as many do, regarding this COVID environment. What are your thoughts about the 5 R's and readiness?
Well, I am not ready. You know, if my housemate were to be exposed and come home and then expose me to the virus, I don't know what I would do. And I think that's something that people my age need to be educated on, perhaps through the university or even through watching this webinar.
So having a checklist for readiness and then even response would be important. Would you know what to do if somebody, a tracer, called and said, you've now been exposed to somebody who's positive and now you need to go into quarantine, or you were told by your doctor you need to be in isolation? Would you know the difference?
I wouldn't know the difference between them, but I know I would be staying home and not going to see, you know, my grandparents or any of my friends for sure.
So what about response? If somebody were to be sick in your living unit or notified that they'd been exposed and needed to quarantine?
I'm not sure most of us would know what to do if someone got sick. I'm not sure if they even know the difference between quarantine and isolation. So that's something that we definitely need to discuss.
What about rescue?
I'm almost certain most of us wouldn't know how to safely get someone to the emergency department while keeping ourselves safe.
What about recovery?
I think recovery is important, and it's good to have a plan.
What about resilience?
You know, I've lived in Houston for a really long time, and I've been through quite a few hurricanes, so resilience is very important, and so are all of the 5 R's.
Great. And so Claire Peck is an NYU student who couldn't be on today, but we've kind of talked about the dilemma that they face when they have to travel at long distances and they're trying to figure out whether to go home or not, and the fact that their family plan needs to be geographically much broader because they have to include transportation. Kyle, would you roll? So, Claire, let's address this idea of a family safety plan. Not only the family safety plan of your family at home, like where you are, where your family is in Hawaii, such a great distance from where you are in New York, but also your home away from home family are the roommates that college students have where they are. And let's talk about the higher risk people that we know that we need to protect. What's your message to college students about those that are more vulnerable and the role that college students can play with a plan like this?
So I do agree that there should be 2 plans, and they look a bit different. So in my current situation, living in New York City with 2 people of my age group, there isn't that problem of a person at risk. However, I am in a big city where you shouldn't really be going out unless you really need to for medical reasons or food or that. But going back home, that plan is a lot different because you're living with your family where you have more resources, and you're living with your family, which means you have more people at risk. And you're coming from a place like college, a big city, where you can't take chances like that, especially on airplanes if you're traveling. You need to be prepared and ready for each of those 2 steps.
So, Claire, you live in New York City, and you have to travel a great distance to get home to your family in Hawaii. This brings up the issue of whether the plan needs to include activities outside of the boundaries of your home or your dorm or your apartment.
Yes, especially when we come back home to our families, we'll need to be extra careful and extra prepared. And I know a lot of kids are in the same boat where you're coming from college where you know, you're exposed to this bubble and then coming home, exposed to your family bubble. You just need to be really, really vigilant and careful about, you know, your journey there.
So, Claire, what about when there are roommates or family members that are at higher risk with underlying illnesses or due to age?
Well, while you need to take it seriously regardless, that in certain cases like that where you're in the same living space as someone who is susceptible, more susceptible, you need to take it more seriously. That means raise all precautions. Even like quarantining in different rooms, that could be a possibility if your work demands that you interact with a number of people in the day. You just need to really be careful because it's someone in your bubble, you know? You need to take all the precautions necessary.
Great. So Perry Bechtel is actually the leader of our college program for MedTech, which is now, as I say, has expanded dramatically with the coronavirus crisis. He's a University of Florida senior, and he actually started the program for MedTech in Florida. He travels frequently here to California to be one of our leaders and teachers. And Perry, we don't want to kind of travel over the same road that we've covered on the plans. Now, from what you've heard from our law enforcement officers, our physicians, our experts in the virus, and nurses, and now from the other college students, what strikes you as the opportunities for us to move forward with our college students? And I'll ask the same question to Danny Policiccio, and then Preston Head, who's in his later 20s, who's looking back on his career at UCLA and his workforce career. I'll ask each of you the same question. Now that we kind of have this perspective, what do you think we can do to get the message out to get some movement? Perry?
Awesome. Thank you, Dr. Denham. It's a kind introduction. So when speaking on planning, I think planning is an absolutely essential element given the virus, but also the most overlooked by young people. In almost every high-risk industry profession, planning and preparation is the main tool used for risk mitigation. But that needs to be shared because we are in a scenario where there is risk, and I think we just need to treat it as like the professionals do. And I think if we spread that message to young people, if we tell them to make a plan, to be prepared, they'll be able to answer kind of a lot of the unknowns. Because I see it, most young people, they'll say, oh, I'm going to quarantine if I get it, but that leaves so many questions unanswered, especially kids who live in high concentration housing, maybe a dorm or a sorority or fraternity house. Things like that, they'll say they'll quarantine, but they don't answer the questions that need to be answered.
Right. Good point. Danny Policiccio, you're an NYU film student along with Claire Peck. Danny has been a producer with us on a number of the films that we've undertaken, and he's been a participant in the teaching that we undertook in middle school and lower schools here in California as we piloted the MedTech program. Danny, your perspective from what you've heard and maybe as a storyteller, how you can get some impact in the college student category.
I wholeheartedly agree with what Perry just said. I mean, we need to have a call to action, and I think if we go something out there towards these students through something like social media, like Instagram, Facebook, Twitter, that it would really give a great response over anything else. And I think through social media, we could have the best impact in making everyone aware and getting a plan out there.
Right, and you and I had the conversation back when it started where you didn't think that there was much interest in the college students, and I think they're starting to wake up to the super spreader sort of environment. In every paper that comes out, we're now seeing more and more of how the spread in the Southeast occurred actually through the college age group. So it's I think the tide is turning quickly. As we think about that, Preston is one of our master instructors for MedTech. He's a former UCLA water polo star. He has been a lifeguard. He's now in business and can kind of look back on the 20s and the college trajectory. And Preston, you can give us kind of a feel for those that are in the workforce that have finished college and that are out there. What thoughts do you have about what impact we can have? Because you're still in that super spreader category.
Thank you, Dr. Denham. Can you hear me okay?
Yes, sir. Go ahead.
Excellent. It was funny. Heather's example of people not taking it seriously really struck a familiar chord with me because not even last week, I had a very close friend who I'm constant in communication with and in contact with who told me he's been quarantining and that he has COVID. And I was with him the day after that he essentially came into contact with someone with COVID, got tested, and everything is good. But it just was interesting to see how he really from just, observing him, he was constantly interacting with people outside of his core group. A lot of people have been traveling, and I've really been quite disciplined on trying to keep my network and who I socialize with very tight, because I do currently live with my family. And to think back of, okay, well, developing a plan, I at one point was in a state of somewhat panic, of, okay, I need to get tested right away. Went and got tested, came out negative, which was great, but I at that point realized, if I had COVID, what would I do, considering my living situation? I go home, my parents are there, and exposing them possibly would be a nightmare. So I think, absolutely having a plan that you can execute and put into place if you come into that situation or experience is a must. And then once you develop that plan, sharing it with friends, sharing it with family, using social media to share and spread the importance of preparation. And one request, I think it would be helpful if, maybe offline, if we could share, example plans just through this group to understand, okay, what does a good plan look like? So those are my thoughts.
Fantastic, and that's just what we'll be doing in our next webinar series. And thank you for that. And I think you and my son Charlie surfing and being out in the we've been able to adjust some of our social activities and physical activities. Thank you for being a mentor there and for helping us with our program. We'll come back to you in just a bit if we have time at the end. But thank you, and you've really given us a good perspective of the older age group as our folks kind of transition out of college. I just dropped in a couple of slides here from our prior program where we talk about COVID risk and some of the humorous slides that have and images that have been out on the web. And I do think we need to use storytelling, and especially now as we head towards our scouting group and our faith-based organizations and dealing with younger people and membership organizations, that we have to kind of keep it fairly light, so that it doesn't get too scary or serious. I think it's serious, but we need, whatever way we can use storytelling with great people like you, Danny, and Claire, and be able to get messages on social media. It'll be helpful. We're heading into our final stretch. And I have the Boy Scouts Scout Oath, the Scout Law, and just to tee up, our membership organizations and faith-based organizations. We'll hear first from Charlie Denham, my son, who's a Scout of a recording. He's in school right now, but we have Reverend Lester McKenzie, who is one of our faith-based leaders in the community here in Southern California. We have Randy Steiner, who's the head of emergency response at the University of California, Irvine, who's been a fabulous help. He's a Scoutmaster as well as a best-selling author, having been through a tragedy earlier in life and been able to turn that into his professional career as an emergency preparedness leader. We have Keith Flitner, an aerospace engineer, our advancement chair in our community here for scouting, and I'm going to ask each one of these folks to talk about how in our faith-based and membership organizations can we leverage using the planning methodology and the learning to really be able to tackle these networks of scouting and faith-based organizations. And we have John Little, who is one of my heroes, who is one of our medical volunteers at my church, Saddleback Church, but also former police officer and part of the security detail that protects our great leaders. And we have John Tomlinson, who's our committee chair. He is an attorney, has a master's degree in business, a businessman, dedicated community leader as well, and had some great ideas about how we can learn more about what we can do in isolation. So as we head on the home stretch here, I'm going to ask Kyle to just play a short clip from Charlie regarding scouting to kind of set the tone for this group on membership and faith-based organizations.
I'm a high school freshman and I've just returned to in-person classes. I'm a Boy Scout now pursuing my Eagle rank. I really believe that the coronavirus crisis provides a great opportunity for Scouts and Scout leaders to serve their communities. Our Scout Law provides a guide. At every meeting, we state what a Scout is. A Scout is trustworthy, loyal, helpful, friendly, courteous, kind, obedient, cheerful, thrifty, brave, clean, and reverent. Our motto is, be prepared. These are perfect principles we can apply to help our families create our family safety plans. We learn a lot about first aid and emergency preparedness that we can also apply to this work. We can help others in our communities do this as well. Scouts are dedicated to provide community service.
So, Randy, that's a setup for, you see what we can do in the communities. You're a Scout leader. How can we leverage the learning of being able to put these family plans to work and maybe have Scout leaders and membership organizations pick up the baton and help in the communities, because our public health systems are so stressed that they really can't do this kind of work?
Well, Chuck, first of all, thanks so much for having me on. Probably one of the best things we can do is, in scouting, all about the scouting method, and that involves keeping the patrols together and working at the patrol level. And that's one of the things we're doing in our scout troop is encouraging patrols to get together in smaller groups and do activities within the COVID guidelines. But really, while on those activities, small campouts, observing and really reinforcing those COVID guidelines in the community to say, make sure we stay 6 feet apart from each other, make sure we're always wearing face coverings, make sure that we only have one person per tent where we normally would have 2 or 3 per tent. So having the students go through that or the scouts go through that and really reinforce those safety measures for COVID, but working within that environment, acknowledging that it's so important for these scouts to continue to get together and continue to work in the community and really work towards Eagle projects that are designed to help the community. I know, Chuck, you're Eagle Scouts down in the coves down in Laguna doing the AED projects, that kind of thing, but with a COVID focus, applying to be, learn how to do contact tracing or how to volunteer at a hospital or do those things in this COVID environment. I think it's a great experience for these scouts to, really use the Scout Law in the real world and really apply it using those methods. So the only way we're going to really teach these scouts to be safe out in the real world is to put them in those situations where they're out there, but they feel safe because those safety precautions are being reinforced constantly.
Well, thank you, and thank you also for deploying our survey through the UCI officers, because it's really helping us know what to do for those folks that are at the front line. And thank you for all you do to take care of our college students here in Orange County. Keith Flitner is an aerospace engineer, a Scout leader, Eagle Scout, and our advancement chair for our community here. Terrific guy, is just constantly dedicated and creative about what to think about where we could kind of leverage these things. Keith, from what you've heard today, ideas about how we could leverage this great network of scouting that we have. We have a lot of Scout leaders on today.
There we go. Thank you very much. Hey, sorry about that. Yeah, look, Scouting is a great program. It starts at kindergarten. It's now available for boys and girls, and it's always been about planning and emergency preparedness and first aid. I remember developing a fire escape plan with my child when he was a Tiger Scout at a very young age. And as you look at Scouting as it goes up, the first aid education first starts off with educating about how to take care of yourself, and then you start learning about how to take care of others. And as you go through the ranks, you add in the service component that was just talked about, and service to not only just your family, but also your community. Ultimately, it progresses through the Eagle Scout project, which is service to the community. But incorporating the best practices of safety for COVID at every step of the way is a natural fit within Scouting. And again, practicing those good habits, again, while being active in Scouting, not only sets an example for the youth, but also for their families and for the community itself when they see Scouts interacting in a safe way. So again, working with Chuck, we've been proactive in making sure we understand what the latest and best practices are and getting them into the Scouting world so that, as we say, we keep Scouting moving.
Great, Keith, and thank you for your dedication to this. And one of the things we're working on right now is to be able to leverage teleeducation and virtual learning to be able to actually convert our entire MedTech program, including Stop the Bleed programs. And now that we're able to do it with CPR and the American Heart Association, I think there are a lot of ways that Scouts can not have to leave their home, put themselves at risk, but also help the rest of the community. So thanks for your dedication and creativity there. Moving
Absolutely.
on to John Little is one of our most dedicated volunteers in the faith-based community, and as I said, a former police officer, has probably taken more care of more gunshot wounds than 10 times all the doctors that have been on this phone call, and is constantly serving and is just a role model for service. John, from what you've heard here, you're representing that kind of, I think, a group that we're just not taking care of, and those are our church volunteers, our medical volunteers, our security volunteers, but the other volunteers that are now going to put themselves at risk as they are ministering to and helping our faith-based organizations. John, thoughts of what you heard today?
Well, first of all, I want to thank you for, I think we're kind of wrapping this up, so I really want to thank you and everybody that's been on the webinar. It's been great. I've listened to every single one of them, and I think we've all learned so much. The question about the faith-based, at Saddleback Church, I work for Saddleback Church. I volunteer there doing the health care and a lot of the protection for the pastor. But I think all the churches have to start getting a really good program of health care. And I think once churches start to reopen, I think if they join your program, I think that will be really, really good. And I don't know if people realize how much you've helped the different churches around the area here. You've donated supplies. You've helped our church out so much. And I just really want to thank you for doing that. And I want to thank you for, like I said, putting all these programs on.
Well, thank you, John. It's your leadership. You're the role model. So, but I really think we can put some programs together for our churches and the church leaders that are listening. We have a certification program for MedTech that we're developing for that purpose. Lester McKenzie, Reverend McKenzie, Father McKenzie, I don't know whether you're still on, but I know there's a power failure in Laguna Beach. But from what you're hearing and the needs that you see as one of our faith-based leaders, thoughts regarding what we can do through and with our churches. Wonder if we've lost Father McKenzie. We know there's a power outage here in Laguna Beach. Speak up if we hear him. We'll move on. Is John Tomlinson still on as well?
Yes, I am.
John, thank you so much for your leadership in the community in so many different ways. We are very, very grateful for all that you've done, and we'll just move forward. We got your picture up now. John is, as I said, he's an attorney. He's a businessman. He's very thoughtful. And I'm putting the pictures up, John, of the isolation chamber that you put together. A really creative idea and something that I think that all of us can take advantage of thinking how we can creatively create an isolation chamber or isolation room. Do you want to give us a quick recap of what you see on the screen? We've got the pictures of your trailer and what you did to set up something for your family.
Well, after watching Apollo 13, I affectionately call this 13-foot trailer the LEM 2. So it's fully self-contained, and I have a generator. In the age of rolling blackouts during this heat wave, you can run the generator, and it's fully self-contained, water, shower, stove, microwave, its own restroom. So if someone were to get sick in my family, they could be placed in this unit, and they can be self-sufficient. If it was me, my wife, obviously if my children were in there, I have to watch over them. But I've learned a lot today, and one of the things I'd like to mention, Chuck, is you're right about the cell phone, because we're all using Zoom, and the biggest commodity around my house is a charging cord for your phone. So if you get shipped off to the emergency room, take your charging cord with you too, your charging cord with you too. I've really learned a lot today, and I did in the last presentation we did, but this is great stuff. And I think that, in our own homes, I have another bedroom that's isolated, and we have to be careful with the HVAC systems in there because they all have returns. And my house is older and it was retrofitted, so it doesn't have a return in this bedroom because you're now taking air out of that bedroom that's an isolation unit and spreading it through the whole house. So a simple roll of duct tape. Always have a roll of duct tape or two on hand, and a roll of plastic, or in lieu of that, you can use garden trash bags, the heavier ones, and you can tape off those vents returns so you're not sucking, potentially, virus-inflicted air into the system in your house. So that's what I got.
Thank you, John. That's so critical because aerosol is, we're really seeing that as a critical issue. We're a few minutes over, but we would love it if you could just fill out the survey that Kyle will be putting up right now. And I'll just go around the table with who is still with us that are live. Chief Adcox, anything you want to add? And then we'll go to Perry Bechtel. And Kyle, would you please put the survey up? Folks, it would be great to hear from you on a survey on where you think you are on the 5 R's.
This is Bill Adcox. I think everything's been covered, and I do encourage everybody to please take the survey. We're doing it here in Houston. It's just very critical, and thank everybody. Just really wonderful people, really wonderful information. Thank you.
Thank you, Bill, and thank you for all you're doing. Heather, anything you'd like to add?
No, thanks, Chuck. I think you did a great job, and I think everyone's on the right track here. I think the key is just to continue to educate and get prepared.
Great. Perry Bechtel, you're our team lead for college students. Anything you'd like to add?
Nothing. I think that was a really thorough brief, and I love to hear all the different perspectives. Everything from Preston, from looking back, as well as that home isolation change I've just shown. I think that was really neat. I think just general education is the best thing and going to get us the furthest. So thank you, Dr. Denham.
Fantastic. Danny Policiccio. And this whole issue of coming home and 2 plans, I think you and Claire could really help us an awful lot for college students that are planning to come back for the holidays and what they need to do. We may have lost Danny. Preston, any final thoughts?
No, thank you so much for this webinar. Just the example plan is my only request.
You got it for our next webinar. It's exactly what we're going to cover. Randy and Keith, anything you'd like to add? You got to kind of do some sum up here at the end.
I'm good. It's just glad that we can keep kids educated and make them our advocates. I think Scouting is a great program for doing that and keeping the family engaged.
Great. And John and John, you both did a great job. So we are going to close today's webinar. We hope that you'll join us, spread the word. These are entirely free. And Part 2 of creating the family plan is exactly what Preston had said. We're going to provide examples and worksheets and a step-by-step approach with taking some of our families. Jennifer, you've been so patient. Jennifer, the last words, and God bless all of you. Thank you. We pray for your safety, and we'll have Jennifer close us, and then we'll finish today's webinar. Jennifer.
Thank you, Dr. Denham, and all of our speakers. I learned so much today, as I'm sure all of you as well have. These webinars are essential for survival, and I strongly encourage everyone here today to please share the recording and invite your friends, family, colleagues, even strangers, neighbors, to these webinars. We're very blessed to have Dr. Denham and his team doing this for us as a country. And I just want to really see these webinars spread because I know they will save lives. God bless everyone. Be healthy, be safe, be careful, and We'll see you next time. Thank you again for being here.
Thank you for your attention. We're really excited about our next webinar when we'll go into templates that you can use as college students, as families, as singles, and we'll focus on the specific checklists that you can use to build out your family safety plan. As we always say, fight the good fight, finish the race, and keep the faith. Everyone is a patient and everyone can be a caregiver.